And we just turn this into something. At the moment, people are worried. Nobody knows where it's going with the medical side. I bow to all of you to tell people like me. I do know that we have poor people in this country already. We have frightened people in this country, and we need to do something about it, and fast.
OK. I'm just going to put some more questions because they're coming in all the time. Val, thank you so much for that. Louise Casey's still here. Simone wants to know this. If we get the virus, are we at risk of catching it again?
The data is we actually don't have a blood test that can check immunity. So we can't be sure when someone's had it how immune they are and for how long. And what we don't know is if someone gets it mildly, how long they are then going to be immune for. I think we were discussing earlier.
I think there's. I think what we really need to look at is the other coronaviruses, and from those we know that people do develop immunity, but that immunity doesn't last forever. It probably lasts many months, maybe a couple of years, but we really don't know the answer to that, and it's really crucial because. All of the mathematical modelling in the world, if you don't know those key numbers to put into the models, then it becomes a little bit of guesswork in the end.
OK. Stella texts this. I'm 85 years old with underlying health conditions. I have 2 carers coming in daily. Do I cancel them?
She needs her carers. The reason she has those carers is because she needs the care. But what they need to do is practice really rigorous, and I can't emphasise this more, and I know I'm sounding like a repeat record, hand hygiene and don't touch your face. But she, like many elderly people, has those carers for a reason. And what's she going to do without them?
Yeah. I'm 68 years old and have CKD and asthma. I've had a sore throat for a week. What should I do?
This is a real problem now. I mean, my surgery was full of people like this last week. We now have no testing in the community to know whether people have got coronavirus or not. Just a sore throat doesn't really meet the criteria for having the virus. It may be, we will find out in due course, there may be some people who've just got a sore throat who have got it. But at the moment, we're going on the diagnostic criteria of having a fever, and that's 38 degrees or above, persistent fever, and a dry cough, or if you've got COPD and you cough anyway, a change in your cough.
Right.
If I may just add,
Please.
this decision to stop testing for coronavirus outside of the hospital setting, I think is a really risky one. You know, diagnostics and surveillance is really the bedrock of epidemic control. It allows us to identify community hotspots and family clusters and isolate and separate and begin to control the epidemic. Not testing makes it difficult for us to really understand how quickly the number of cases are rising overall.
Do we have the capacity to test outside of hospital?
We should. South Korea is testing 10,000 patients a day. We've tested 40,000 in the entire country since this began. You know, if there are challenges, we need to overcome them and meet them. But we're giving up one of the most critical tools we have. This is akin to turning off the lights on the battlefields in the middle of a war. You don't have the information that you need. We're operating in the dark without those figures.
Can I ask you what would be the reasons from the Chief Scientific Officer, Chief Medical Advisor, what would be the reasons for only testing in hospital rather than in the community?
I can't speak for them.
No, I know that. Coming from a science point of view.
My understanding is that the strategy here is to essentially concede that we're not going to try to stop the spread, but that we're going to try to allow it to spread through the country's entire population, albeit by controlling the rate at which it happens so it doesn't overwhelm the health system. And so that perhaps that underlying idea may allow them to think that it's not necessary to be testing everybody. Again, I think that if you want to control how quickly this is spreading, you need that information.
We also particularly need it for doctors, nurses, ambulance drivers, people on the front line, carers. Because otherwise we're going to have a situation where you've got people self-isolating and not going to work on the front line in the social care and in the health service, people self-isolating when they don't need to, and then you're also going to have people thinking, I haven't got the virus, when they do.
This viewer says, I'm 17 weeks pregnant and currently worried about what impact this will have on me and my unborn baby. What is the advice for pregnant women?
The advice for pregnant women is actually the same for everybody else.
Yeah.
Unlike swine flu back in 2009, which did seem to be quite nasty in pregnancy, this coronavirus actually doesn't seem to be any worse in pregnancy, and so far there is no evidence it can harm an unborn baby. So reassurance there.
Let's say I come down with a virus, so I isolate for 7 days. I recover. What did I have? Can I still get coronavirus? I mean, that is a really good question.
It is, because you can, unless you've been tested, you can never know that's what laid you low. So you just still need to be careful, still need to limit your contacts.
Kathy says, how does one get hold of a testing kit?
You can't. You can't, and certainly don't go and try and buy one online, because they don't work, they're false, there's people racketeering. At the moment, the only way you can get tested is via 111 or via a hospital.
Sandy...
GPs don't have testing kits.
OK, Sandy says, if you have something else wrong with you other than coronavirus, how do you get to see a doctor? Mine is doing over-the-phone appointments only. I have an ear infection and I need it checking.
So what we've done in my surgery is, like everywhere else, we've been advised to switch to telephone appointments. What we're doing is what we call telephone triage. So you get a telephone appointment, and for something like this, we would say in our surgery, OK, we need to see you, and the doctor will book you in for an appointment. And then when you get to the front door of my surgery, you ring the bell and you say, I've got an appointment with the doctor, it's been cleared by the doctor. We are also, as well as telephone appointments, in my surgery, we're saying to people, look, if you've got something like a sore ear, or you've got joint pain, something like that, send us an email why you want to be seen. Or if you've got a breast lump, we need to see you. So email us or call us and we will sort out who we need to see and then let you in through the door.
Can I walk my dog if the virus is airborne?
It's the same advice, it's keeping your distance. So yes, absolutely.
Yeah.
And people need to get out and about and take exercise.
Right, I'm bricking it. Hi, Victoria, I'm bricking it. My daughter is profoundly autistic and can be quite violent. I must confess to being far more scared of having to isolate with her for up to 4 months than I am of either of us getting infected with COVID-19, and I'm classed as high risk. So my concern is this, and I suspect there are lots of families in a similar situation. In the event that we do have to self-isolate, would we be able to go out in our vehicle at all? My daughter gets pleasure from watching freight trains, and I wondered if, as long as we stayed within the car, if we would be able to venture out. She's non-verbal, she has a mental age of 2.
Yeah, I mean, I think this highlights the fact this is a marathon, not a sprint.
So can this person go out in their car?
Absolutely. Yeah, absolutely go out in the car.
Even during, because this person is over 70, it sounds like, or classed as high risk anyway, even at the point at which over 70s are asked to self-isolate?
We don't yet know quite what self-isolation is going to mean.
Well, we do know what the Transport Secretary, who's a Cabinet Minister and in government, said on the radio this morning, which was that you can go out, even in self-isolation as an over 70. You can walk your dog, you can go out.
Yeah, absolutely.
OK. Alice Disco says, I have a new cough, so I've been advised to stay at home, but my partner's not sure what to do. Their employer, a charity, has told them to come in because I'm not a confirmed case. But there are no tests, so how could I be a confirmed case?
At the moment, the advice is the person who's ill stays at home and self-isolates for 7 days, but the family and the household carry on as normal. Okay. That may change.
OK. Thank you all very much. Really appreciate it. Thank you. Thanks for coming on the programme. And we are going to get those daily news conferences now from the Prime Minister. So as soon as we know what time that is happening, you'll see it on BBC News. Thanks for your company today. Back tomorrow at 10. Join us then.